Let me ask you something. Do you remember the moment you turned 60? Maybe you thought, okay, I am getting older, but I still feel pretty good. Then 70 came around, a few more aches, a little more tiredness, but still, you managed. Now imagine waking up the morning after your 80th birthday. Something feels different. Not dramatically, not overnight, but something has shifted. Your body is quietly telling you something new. And here's the thing, nobody prepares you for. Turning 80 triggers very specific, very predictable changes in the human body. Changes that happen to virtually everyone who reaches this milestone, whether you are in great shape or not, whether you eat well or not, whether you exercise or not. These 5 changes are coming, but here's the good news. Knowing about them in advance, that changes everything. Because when you know what is coming, you can prepare, you can adapt, and you can continue living a full, meaningful, independent life well into your 80s and beyond. So stay with me, because what I am about to share could be the most important health information you hear this year. Hello and welcome back to the channel. If you are new here, I am so glad you found us. This channel is dedicated entirely to helping seniors and their families navigate the real, honest truths about aging. Not the sugar-coated version, not the scary version either, just the truth, delivered with care, respect, and practical advice you can actually use. Today we are talking about what happens to the human body once you cross the threshold into your 80s. And I want to be upfront with you. Some of what I'm going to share might surprise you. Some of it might even make you a little uncomfortable. But every single point comes with practical strategies to help you manage these changes and maintain the best possible quality of life. Because turning 80 is not the end of anything. For millions of Americans, it is the beginning of a whole new chapter, one filled with wisdom, family, purpose, and yes, some new health realities to navigate. So let us talk about all 5 of them, starting with the one that catches almost every 80-year-old completely off guard. Body change number 1. Your muscle mass begins disappearing at an alarming rate. Here is something most people do not realize. From the time you are born until about age 30, your muscles grow and strengthen. From 30 to about 60, you lose muscle slowly, maybe 1 to 2% per year, enough to notice, but manageable. But after 80, the rate of muscle loss accelerates dramatically. Scientists call this sarcopenia, which simply means the age-related loss of muscle mass and strength. And after your 80th birthday, it kicks into high gear. Here's what this looks like in real life. You reach up to get something from a high shelf, and you realize your arms feel weaker than you remember. You try to get up from your favorite chair, and you need to use both arm rests and really push yourself up. You walk to the mailbox and back, and feel more tired than you think you should. Sound familiar? This is sarcopenia, and it is not just about feeling weaker. Muscle loss after 80 has serious consequences. It is one of the leading causes of falls in seniors over 80. And falls, as I am sure you know, can be absolutely devastating at this age. Studies show that up to 30% of seniors over 80 who break a hip do not survive the following year. That is not meant to frighten you. That is meant to show you how important it is to take this seriously. But here is the encouraging part. Muscle loss after 80 is not inevitable in the way most people think. Yes, it happens to everyone. But how much muscle you lose? That you can influence. Here's what you can do. First, resistance exercise is your best friend. Even light resistance training, using small weights, resistance bands, or even your own body weight, can significantly slow muscle loss at any age. Studies have shown that people in their 80s and even 90s can build muscle with the right exercise program. You do not need to become a weightlifter. Simple exercises like chair squats, wall push-ups, and resistance band pulls, done 3 times a week, make a real difference. Second, protein intake becomes critically important after 80. Many seniors do not eat enough protein. Aim for protein at every meal. Eggs, chicken, fish, Greek yogurt, beans, and lentils are excellent choices. Third, talk to your doctor about your vitamin D levels. Low vitamin D is extremely common in seniors over 80, and it contributes to both muscle weakness and fall risk. A simple blood test can check your levels, and a supplement might make a significant difference in how strong you feel. Body change number 2. Your brain begins processing information more slowly. Now let us talk about something that many 80-year-olds notice, but feel embarrassed to mention. The brain slows down, and I want to be very careful here, because there is a big difference between normal age-related cognitive slowing and something more serious like dementia. Normal cognitive aging after 80 looks like this. It takes a little longer to remember a word. That is on the tip of your tongue. You walk into a room and briefly forget why you came in. You need a moment longer to process new information. You occasionally forget a name, but remember it later. These are normal. These are not dementia. They are the result of natural changes in how the brain processes speed and retrieves information. Think of it this way. Your brain is like a computer. After 80, the processor does not run quite as fast as it used to, but the hard drive, all that wisdom, experience, and knowledge you have accumulated over 80 years, that is still very much intact. In fact, research shows that certain cognitive abilities actually improve with age: vocabulary, emotional regulation, wisdom-based decision-making, pattern recognition from experience. These all tend to stay strong, or even get better, well into the 80s and beyond. But here is what you need to watch out for: the line between normal cognitive slowing and early dementia. Warning signs that go beyond normal aging include getting lost in familiar places, forgetting the names of close family members, repeatedly asking the same questions within a short time, confusion about what year or decade it is, significant personality changes, difficulty managing finances or medications that were previously easy to handle. If you or someone you love is experiencing these signs, please talk to a doctor. Early diagnosis opens the door to treatments and strategies that can preserve independence and quality of life much longer. Here is what you can do. Keep your brain active every single day. Read books, newspapers, or articles. Do puzzles, crosswords, or word games. Learn something new, even if it is just a new card game or a new recipe. Stay socially engaged. Conversation and social interaction are among the most powerful brain protectors known to science. Exercise your body too. Physical activity increases blood flow to the brain and has been shown to reduce the risk of dementia. And perhaps most importantly, prioritize sleep. During deep sleep, your brain literally cleans itself, flushing out toxic proteins that are linked to Alzheimer's disease. Poor sleep after 80 is one of the most underestimated threats to brain health. Body change number 3. Your heart and cardiovascular system become significantly more vulnerable. Here's a sobering fact. Heart disease is the #1 cause of death in Americans over 80, and it is not because 80-year-olds suddenly develop bad habits. It is because after 80, the cardiovascular system undergoes changes that make it fundamentally more vulnerable, regardless of how healthy you have been. What changes? The heart muscle itself becomes slightly stiffer. This means it does not fill with blood as efficiently between beats. The arteries, which carry blood from the heart to the rest of the body, become less elastic. They are less able to flex and accommodate changes in blood flow. This leads to a condition extremely common in seniors over 80 called isolated systolic hypertension. That is a fancy way of saying the top number of your blood pressure goes up while the bottom number stays normal or even drops. Many seniors over 80 also develop what doctors call orthostatic hypotension. This is when your blood pressure drops suddenly. When you stand up from sitting or lying down, you might feel dizzy, lightheaded, or unsteady for a few seconds after rising. Many seniors dismiss this as just being a little dizzy, but this is actually one of the most common causes of dangerous falls in people over 80. If this sounds familiar to you, please tell your doctor. There are real solutions. Here is what you can watch for: unexplained fatigue that is new or getting worse, shortness of breath with activities that used to be easy, swelling in your ankles or feet, a feeling of heaviness or pressure in your chest, dizziness or lightheadedness when standing, heart palpitations, a feeling that your heart is racing or fluttering. Any of these symptoms deserve a conversation with your doctor. Do not dismiss them. Do not wait. Here is what you can do. Monitor your blood pressure regularly at home. Home blood pressure monitors are inexpensive and easy to use. Keep a log of your readings and share them with your doctor. Rise slowly from chairs and beds. Pause at the edge of the seat for a few seconds before standing. Hold on to something stable when you first stand up. Stay well hydrated. Dehydration worsens blood pressure instability dramatically in seniors over 80. And continue to move. Even gentle walking is one of the best things you can do for your aging heart. Before we continue, I want to pause for just a moment. If you are over 60, over 70, or especially if you or someone you love has recently turned 80, this information is genuinely important. These are not scare tactics. These are real changes that real people experience, and knowing about them in advance gives you and your family the power to respond wisely. If you are finding this helpful, please take a second right now, hit the like button, and subscribe to our channel. We release new senior health content every single week, and please share this video with someone you care about, a parent, a sibling, a friend who is turning 80. This could genuinely make a difference in their life. Now let us talk about change number 4. This one affects virtually every single person over 80, and most people never connect it to the broader health picture. Body change number 4. Your immune system becomes significantly weaker. Here is something that might surprise you. The immune system, your body's defense against infections, disease, and illness, undergoes one of its most dramatic declines after age 80. Scientists have a name for this. They call it immunosenescence, which simply means the aging of the immune system. What does this mean in practical terms? It means that an infection that a 40-year-old shakes off in 3 days might take an 80-year-old 2 to 3 weeks to recover from. It means that a simple urinary tract infection, which might cause mild discomfort in a younger person, can cause sudden confusion, extreme weakness, and hospitalization in someone over 80. In fact, sudden confusion in an elderly person is one of the most common signs of infection. Many families panic, thinking their loved one is suddenly developing dementia, but often it is an infection that the weakened immune system is not fighting effectively. This is critically important for families to know. If an elderly person over 80 suddenly seems confused, disoriented, or unlike themselves, get them checked for infection immediately. A simple urine test or blood test can often identify the cause, and with prompt treatment, they can return to normal relatively quickly. The weakened immune system after 80 also means that vaccines become even more important, not less important. Here is what you should make sure you have. Annual flu vaccination. Every year, without exception. Pneumococcal vaccine. There are 2 types now recommended for seniors over 65. Ask your doctor if you have had both. Updated COVID-19 booster. RSV vaccine, now recommended for adults over 60, and shingles vaccine. Shingrix is recommended for all adults over 50. Shingles in someone over 80 can be absolutely devastating and can lead to severe long-term nerve pain. If you have not had Shingrix, please talk to your doctor or pharmacist today. Here are other ways to support your immune system after 80. Adequate sleep. The immune system does most of its repair work while you sleep. 7 to 8 hours remains important, even in your 80s. Good nutrition. Colorful vegetables and fruits are packed with antioxidants that support immune function. Stay hydrated. Many seniors over 80 do not feel thirst as strongly as they once did. But dehydration severely weakens immune response. Aim for 6 to 8 glasses of water daily, And limit alcohol. Even moderate alcohol consumption suppresses immune function in older adults. Body change number 5. Your relationship with sleep changes completely. This final change is one that almost every person over 80 experiences, yet very few talk about it openly, and even fewer understand what is really happening. After 80, sleep changes fundamentally, and not in the ways most people expect. Here is what typically happens. You start waking up earlier than you ever did in your life. 4 a.m., 5 a.m., sometimes even earlier. No matter what time you went to bed, you find yourself falling asleep earlier in the evening. 7 p.m., 8 p.m. feels late. You wake up more frequently during the night, sometimes 2, 3, 4 times, and you feel like you never get truly deep sleep anymore. You might nap during the day without meaning to. And despite spending a lot of time in bed, you wake up feeling like you have not really rested. Does any of this sound familiar? Many seniors over 80 assume this is just what getting old feels like. They accept poor sleep as inevitable. But here is what you need to understand. Poor sleep at 80 is not just an inconvenience. It has serious downstream health consequences. Poor sleep is directly linked to increased risk of falls and accidents. It worsens memory and cognitive function significantly. It weakens the immune system. It increases inflammation throughout the body. It raises blood pressure, and it is strongly associated with increased risk of depression in older adults. So what is actually happening? After 80, the brain produces less melatonin, the hormone that signals your body it is time to sleep. The internal clock, what scientists call the circadian rhythm, shifts earlier. This is called advanced sleep phase syndrome. And it is extremely common after 80. Here is what you can do. First, talk to your doctor about your sleep. Many seniors do not mention sleep problems because they assume nothing can be done. But sleep disorders are treatable. Sleep apnea, in particular, is extremely common in older adults and dramatically improves with treatment. If your loved one snores loudly, gasps during sleep, or seems excessively tired during the day, despite sleeping long hours, please ask their doctor about a sleep study. Second, maintain a consistent sleep schedule. Go to bed and wake up at the same time every day, including weekends. This helps regulate the internal clock. Third, get morning light exposure. Step outside or sit near a bright window every morning. Morning light is one of the most powerful signals to your body's internal clock. Fourth, limit screen time in the evening. The blue light from televisions, tablets, and phones suppresses melatonin production. Dim lights and screens at least 1 hour before bed. Fifth, be careful with sleep medications. Many common sleep aids, including over-the-counter medications like Benadryl and prescription sleep pills, are particularly risky for seniors over 80. They increase fall risk dramatically, and they can worsen memory problems. Talk to your doctor about safer alternatives. Now I want to take a step back and offer some important perspective, because I realize we have covered a lot of heavy information today, and I do not want you to walk away from this video feeling discouraged or afraid, or like turning 80 is something to dread. Because here's the truth. These 5 changes happen to virtually everyone who reaches 80. The person who ignores them, and the person who addresses them head on. But the outcomes for those 2 people look completely different. The person who ignores these changes often finds themselves in a cycle of decline. Falls lead to hospitalization. Hospitalization leads to weakness. Weakness leads to more falls, and quality of life erodes. But the person who faces these changes with awareness, preparation, and proactive care, they continue to live independently, meaningfully, and joyfully. They stay engaged with family. They travel. They pursue hobbies. They laugh. They contribute, and they inspire everyone around them. The goal of living to 80 and beyond is not just to survive. It is to thrive. And thriving is absolutely possible with the right knowledge and the right support. Here's your action plan starting today. Number 1. Talk to your doctor specifically about the changes we discussed today. Ask about your muscle strength, your cardiovascular health, your vaccine status, and your sleep quality. Ask them to review all your medications for ones that might increase fall risk or affect cognition. Number 2. Start or continue a gentle exercise routine, even 20 to 30 minutes of walking, and light resistance exercises 3 times per week makes a measurable difference. Number 3. Review your home for fall hazards. Remove loose rugs. Install grab bars in the bathroom. Make sure all areas are well lit, especially at night. Consider a nightlight between the bedroom and bathroom. Number 4. Stay socially connected. Call family. Meet friends. Join a senior center or faith community. Social connection is one of the most powerful medicines available to people over 80. It protects the brain, the heart, the immune system, and the spirit. Number 5. Share this information with your family. Adult children and caregivers who understand these changes are better equipped to help their loved ones navigate them wisely. Let us quickly recap the 5 changes that happen once you turn 80. Number 1. Muscle mass begins disappearing faster. Fight back with protein and gentle resistance exercise. Number 2. The brain processes information more slowly. Keep it sharp with mental activity, social connection, and good sleep. Number 3. The heart and cardiovascular system become more vulnerable. Monitor blood pressure, rise slowly, stay hydrated, and keep moving. Number 4. The immune system weakens significantly. Stay current on all vaccines and prioritize sleep, nutrition, and hydration. Number 5. Sleep changes completely. Talk to your doctor, maintain a consistent schedule, and be cautious about sleep medications. These changes are real, they are coming, but they do not have to define your 80s. Knowledge is power, and now you have both. To every person watching this who is 80 or approaching 80, you have lived through things that would humble most people. Decades of experience, love, loss, joy, struggle, and triumph. Your 80s can be lived with the same dignity, purpose, and vitality that have defined the rest of your life. These changes do not make you less. They make you human. And with the right information and support, you can navigate every single one of them. To the family members and caregivers watching, thank you for being here. Thank you for caring enough to seek this information. Your attention and love make a profound difference in the lives of the seniors you care for. If this video was helpful, please give it a thumbs up. It helps more seniors and families find this information when they need it most. Subscribe to our channel and hit the notification bell so you never miss our weekly senior health videos. Share this video with someone you love who is in their 70s or 80s, or with an adult child who wants to better understand what their aging parent is experiencing. And please drop a comment below. Tell me, which of these 5 changes resonated most with you? Are you experiencing any of them right now? I read every single comment, and your story might be exactly what someone else needs to hear today. Thank you so much for watching. Take care of yourself, take care of each other, and I will see you in the next video.